To today evening's webinar, New Tools to Protect Communities from Air Pollution and Heat. My name is Sanjana Bhatia, and I'm a fourth-year medical student at UT Southwestern Medical School in Dallas, Texas, and also a board member for the Texas Physicians for Social Responsibility. We would love all of y'all to put your name and where you're calling in from in the chat so we can kind of get to know everyone. Before we get started, I want to take a moment to introduce Texas PSR to anyone who is joining us for the first time. Guided by medical and public health expertise, Texas PSR works to protect human life from the gravest threats to health and survival through outreach, education, and advocacy. Texas PSR's membership is geographically and professionally diverse, with members in all major cities representing physicians, nurses, and other healthcare professionals, along with other concerned citizens. Our strategy for achieving positive change is to provide a conduit for the medical community to educate and inform the public and lawmakers about potential threats to public health through education, analysis, and expert testimony on key issues such as climate change, food systems, toxins, and nuclear weapons. All right, I am going to introduce our webinar speakers. This evening, we will be hearing from Dr. Sheila Modi and Dr. Colin Phillips. Dr. Sheila Modi is an assistant professor in the Department of Internal Medicine at UT Southwestern Medical Center in Dallas, Texas. She works as a primary care physician. She is passionate about addressing the impact of climate change on health. She teaches medical students and residents, and in that role, she helps run a medical student elective on climate change and health every spring and has given several lectures on this topic to students and residents. She serves on the Sustainability Committee at UT Southwestern. She also works as part of HAQ's app team. She hopes the HAQ app will not only increase awareness about the impact of climate change and health, but also provide and connect people with resources that can help mitigate those effects. Dr. Colin Phillips is a practicing interventional cardiologist in Portland, Maine, interested in the intersection between air pollution and cardiovascular health. He is a board member of Maine PSR and recently chaired the American College of Cardiology Climate Change and Cardiovascular Health Working Group. We are so excited to introduce them and excited for them to take it away.
Thank you so much, Sanjana, and thank you, Driti and Giselle, for setting this up. On behalf of Sheila, we're happy to have you tonight, and are looking forward to sharing our talk tonight. I'm going to work on sharing my screen here. So our talk is Heat, Air Pollution, and the Tools to Protect the HAQ app and the ACC Infographic. So our objectives tonight are to understand the mortality risks of air pollution and heat, to recognize the synergistic effects of air pollution and heat, to recognize the inequity in exposure of these dual risks, and how to give patients tools to mitigate these risks of air pollution and heat. And that's, of course, the ACC infographic and then the HAQ app. So why should we be talking about air pollution, heat, climate change in general? And the underlying reason is that our lives and conditions, our living conditions and exposures matter to our health. Our lives sort of depend on this stuff. In 2021, air pollution was responsible for over 8.5 million deaths worldwide. 4.75 million of those were cardiovascular deaths. So for me as a cardiologist, I am interested in how air pollution is affecting cardiovascular health. And so this is data that came from the Global Burden of Cardiovascular Diseases and Risk, a few years old, but the numbers still stand true today. And so environmental risks, the ambient pollution, particulate matter, both the particulate matter pollution and pollution from solid fuels play the largest role from environmental risks and are not quite as detrimental as high systolic blood pressure, but still very detrimental. And so air pollution has a direct line to cardiovascular disease. Increased exposure to air pollution increases blood pressure. It increases the risk of heart attacks. It increases the risk of dying from the heart attack. It increases risks of electrical issues like atrial fibrillation. increases risks of heart failure, increases risk of stroke, increases risk of diabetes, hospitalization, death, and on the other end, premature birth. And so, you can look at this in the inverse and think, what if I had a drug that would do the opposite of all this, that decrease blood pressure, decrease the risk of heart attacks, death, stroke, diabetes, things? We would be very, very interested in it, and we should be equally interested in how air pollution serves as this risk factor and risk multiplier. So air pollution deaths are expected to increase, and this is data looking at how, with increased carbon dioxide in the atmosphere, you have increasing temperature, and these two things are related. More carbon dioxide is related to increased particulate pollution, and all these things are linked. More fossil fuel burning, more pollution. And this is data from ExxonMobil. They've known about it for a long time, and their predictions have been remarkably accurate. And here in Maine, our Attorney General, Aaron Frey, has joined a bunch of other states in suing the fossil fuel big oil companies for deception and hiding this information from the general public. So, as we look forward in the future, it's clear that our energy needs continue to grow. There's an increasing reliance on diesel and coal power generation. Renewable energy products have been halted over the past year and a half. And recently, the Environmental Protection Agency's endangerment clause, part of the Clean Air Act, a rule that has been in existence for the last 16 years or so, was overturned. And so things like AI data centers, processing blockchain for Bitcoin, using AI with voice, all these things are just increasing stresses on the energy grid, and oftentimes the energy that is being used is all polluting fossil fuels that are affecting the neighborhoods that that these physical data centers are residing in. And so I oftentimes do the thought experiment of, if you asked AI, how would we stop global warming? If it really did have the answers, it would just stop burning energy and turn itself off. And so, sadly, this past year, the United States has led the global surge in gas-fired power, which is largely driven by artificial intelligence demands, and again, big cost for the climate.
Okay, so in addition to air pollution, heat is another thing that we have to think about as far as environmental exposures. The World Health Organization estimates that approximately 489,000 deaths per year are attributed to heat. Many of those deaths are in Asia and Europe, and the reason they have so much more deaths than the United States is because here in the US, we have widespread air conditioning access, whereas in a lot of places in Europe and Asia don't. Next slide. This is a study that actually looked at death certificate data in the US and looked at heat-related illness. And you see a pretty significant increase starting around 2016. But in 2023, the highest year in the study, there were 2,325 heat-related deaths in the US. This is considered to be a really drastic undercount because almost nobody is putting heat on the death certificate, even if that was a major contributing factor. And so this is mostly only capturing people dying of heat stroke, but not really capturing where heat is a contributing factor, which will become more apparent later when we talk about what heat does. Next slide. This is a study that was done using modeling. There was a global heat wave in 2023 in the summer that really caused increased heat deaths worldwide. Again, most of those in Europe and Asia. In this study, they estimated, and I put an arrow pointing to this key number, 178,486 excess deaths just due to this one heat wave in July and August of 2023. And on this graph, you can see the increased odds ratio per region. And of these deaths, they calculated that about 54% of those were attributed to human-induced climate change. Next slide. This is just a graphic showing that of all the weather-related fatalities, heat is by far the biggest killer. Next. And then when we talk about heat-related illness, it's important to think about all the different things that can affect someone's susceptibility to heat-related illness. So we have things like age. It tends to be affecting more the very young or the older populations, coexisting conditions, things like obesity, heart disease, asthma, diabetes, chronic kidney disease, mental illness, and then pregnancy also increases the risk. Certain medications, especially anticholinergics, because those impair sweating, and then drugs like diuretics, because they can increase the risk of dehydration. Cognitive impairments make people sort of unable to get themselves into a safer situation. People with disabilities. Social isolation is also a risk factor. And then you have to think about exposure. And so people who have greater exposure have greater risks. We will talk about heat amplification and urban heat islands in just a minute, and also occupation. And then also lack of access to cooling at home. Actually, Sanjana, who gave the introduction today, she led an effort where we did a community survey and found that while a lot of people in Dallas have air conditioning, almost half of them didn't use it because they were concerned about their energy bills. So access and energy poverty is another thing to think about, going along with sociocultural factors. Next slide. So occupation, I wanted to talk a little bit more about this. This is a study that was done with OSHA in 2023. They passed a law that all companies that have 100 or more employees have to report any workplace-related injuries to this database. And so then they looked at all the injuries reported in the database and found a very consistent effect of increased workplace injuries with increased heat, clearly increasing from 85 and 90 degrees. And then what was also interesting in this study is that they found that when the heat index was 110 or higher in states that didn't have workplace protections, which is most of them, the increased risk was 22%. So you had a 22% increase of workplace injury. But in the states that had worker protections for heat, you only had a 9% risk with the same heat. So that shows that workplace regulation is effective at preventing heat-related illness. Bringing it back to Texas, Texas does lead the nation in work-related heat deaths. That's data from the U.S. Bureau of Labor and Statistics. And in 2023, those of you outside of Texas might not know, but Texas passed a bill that eliminated local ordinances that were requiring basic worker protections from heat, including rest, water, and shade. So now, and also in the absence of a national heat standard, there are really no worker protections here. Thinking about other things that increase your risk of heat are urban heat islands. If anyone is not familiar with that term, what that is that when you go from a more rural area with greenery and water, the greenery reflects more of the sunlight and the water helps cool the air. And then you go into more urban areas that have concrete, that are dark colored, that don't have the greenery, you get a significantly higher temperature because all of these dark surfaces, they absorb the sunlight and then retain it. And then you have, more heat generated by the human activities around there. And then at night, this is the key thing about urban heat islands, is that at night, when normally you get a break from the heat, in urban heat islands, that heat gets re-radiated out from the buildings and everything that was storing the heat during the day. And so the nighttime temperatures get even hotter. And so people don't have that reprieve from the heat at night. And in urban heat islands, the temperature can be on average about 7 degrees hotter than it would be in a rural area. Okay, you can go to the next slide. Once again, Dallas is one of the worst in the nation as far as urban heat islands. The DFW Metroplex is one of the worst, with about 75% of the residents living in areas with about a 7.7 degrees higher temperature than it would be in a surrounding rural area. And UT Southwestern, where I work, is located within the largest urban heat island within the city of Dallas. So when people think about heat-related illness, this is what people tend to think about, this the sort of heat injury spectrum. So it goes from more minor things like heat rash or heat edema, and as the body gets more and more, has more trouble coping with heat, you can get syncope, and then you can progress to heat exhaustion or even heat stroke. I mean, it's very important to think about these things. Heat stroke is a really high risk of mortality. Somebody coming in with severe heat stroke, the mortality is greater than 60%. And so it's really important to recognize this early and have prompt care. But this is actually not the reason most people are dying from heat. Next slide. So most people are dying from heat actually because of cardiovascular illness. So this is a study, it looked at temperature and found that a 1 degree Celsius temperature rise increased mortality from cardiovascular, respiratory, cerebrovascular, and then morbidity in all of these as well. So the number 1 is cardiovascular, and the number 2 is pulmonary. Next slide. This makes sense if you think about the physiology of heat and what heat is doing to the body. So if you think about the body, you're always generating heat through your metabolism, and then when it's hot outside, you're absorbing heat from the sun. And the 2 ways your body has to regulate that, to dissipate that heat from your body, are by sweating, evaporative cooling, or by radiation. And so on this figure, you can look at the blue circle first, and that represents sweating. So your body is responding to heat, you're sweating, and then you can get dehydrated. That dehydration then can affect the kidneys and cause some strain on the kidneys. And then you can sort of move into that top circle where if you get too dehydrated, you can go into hypovolemic shock, right? So you can have endotoxin release, heat-related cell death, organ failure, and this is how most people die from heat stroke. On the right side, you think about the other way your body is cooling is through radiation. So when it's hot, your body is shunting more blood to the periphery. And with that, the heart has to work faster and harder. And if you think about somebody who has pre-existing heart disease, maybe someone with some significant coronary blockages or someone with heart failure, then that increased supply-demand mismatch can trigger heart attacks or heart failure exacerbations. And then when you combine this with what's also happening in the body as far as sweating and dehydration, then that only works together to make this worse. And so that's kind of, when you understand that, you think about, oh, well, it makes sense that cardiovascular then is the most common cause of death from heat. Next. And then another thing to think about is that these things are not happening in isolation. So it's important to kind of think of everything happening all together. And so heat and air pollution can be synergistic in several different ways. So heat can contribute to worse air pollution. One of the ways that that happens is that heat can actually cause the creation of more ozone. And so that happens through a chemical reaction. So you have sunlight and photons. And if you have an area with pollution, so you have nitrous oxides and volatile organic compounds. And so it can knock one of those oxygens off, and then that binds with an O2, and that creates O3, which is ozone, also known as smog. And so then that can create kind of a runaway cycle if you have volatile organic compounds. And so you can have more ground level ozone created just because of heat. And then another way is that heat can increase the wildfire risk. And then, of course, wildfire smoke is more source of air pollution with particulate matter in the air. And then another way you can think about it being synergistic is that these two exposures together, so exposures to heat and high particulate matter exposure, have a synergistic worsened effect on outcomes. So they can increase the risk of heart attacks, strokes, and all-cause mortality. Next.
And this is a study demonstrating just that, where extreme heat and poor air quality are dual threats to cardiovascular and pulmonary health. This is a study out of China where they did careful monitoring of both ambient temperature and fine particulate matter, and they demonstrated that the longer the exposure for both of these things and having them together resulted in a higher mortality from heart attacks. And so once again, it's the synergistic balance. The two things are being caused by each other, and then they're worsening inside the body the mortality from heart attacks. And they attributed of this study 2.8% of the MI of the heart attack deaths to the heat waves and particulate pollution. And women and elderly were the most vulnerable to these exposures. So recently, in the last month, in the world of cardiology, there's been a union of the European Society of Cardiology, the American College of Cardiology, the American Heart Association, and the World Health Federation coming out and talking about environmental stressors in cardiovascular health. And so, again, all these things are joined together and related to one another. And so climate change, temperature extremes, as we were just discussing, wildfires with the particulate matter, and also air pollution from dynamic sources like cars, but also standalone sources like energy generation, are all linking together and combining into cause worsened cardiovascular disease and outcomes. And so the group in this paper did a nice job of showing both planetary and cardiovascular health being two indivisible parts of the same token. And so on one side, you've got what's happening on the Earth, and then inside is what's affecting the heart and inside your body. And so they found that these environmental risk factors include many interconnected things made by human activity, and they have compounding health impacts: air pollution, noise exposure, artificial light, plastic pollution, chemical pollution, and the various effects of global warming, such as heat extremes, desert storms, floods, and wildfires. So it's a wonderful document that these groups have combined to put together, and really is a nice way of showing how all these things are connected.
So this is a study very similar to the one that we just talked about heart attacks and mortality. This one showing that exposure to particulate matter and heat can increase the risk of stroke mortality. And what I circled was the key finding that co-exposure to both acts synergistically to trigger stroke deaths. In this study, they looked at particulate matter 2.5 and sort of separated it out into its various constituents. And so that's why, if you go to the next slide, on the graphs, that's why there's all the different columns. So you have the particulate matter 2.5 on the first column, which I think is the easiest one to just look at, and then the rest are just separated out. But they all, basically show the red bars, the REOI, that stands for relative excess odds due to the interaction of both. So you can see that the interaction of both heat and excess particulate matter had a significantly increased odds ratio for death from stroke. In both, the first row is overall strokes, so for all strokes, and then they separated that into hemorrhagic and ischemic. So in all strokes, it's worse. Next slide. So Another thing that it's important to think about is pollution inequity. And so a couple of terms to highlight here. One is pollution inequity, which is the difference between the environmental health damage caused by a racial or ethnic group and the damage of pollution that that group experiences. And then related terms are pollution burden, which is a group that experiences more pollution exposure than what is caused by their consumption, and pollution advantage, which is the opposite, a group that experiences less. Next slide. So there have been multiple studies looking at this. I just put a couple of them on here. But this is a study that looked at particulate matter exposure and sort of compared it to the consumption of goods and services. And so you have a higher consumption of the polluting causing goods and services by the non-Hispanic white majority, but that pollution is disproportionately experienced by Black and Hispanic communities, with the non-Hispanic white population having a 17% less air pollution exposure, and Black and Hispanic communities with a 56 and 63% excess exposure relative to their consumption. Next slide. This is a different study, kind of looking at a similar thing. This one separated out between different areas. So that's what the numbers 1 through 10 are, like different regions. But then, you know, the easiest way to look at is the first one, the overall column. And so the poverty was one of the most significant predictors of having more particulate matter exposure. And then when you break it down as far as race, Black populations have a significantly 1.54 times higher pollution burden. And then again, bringing it back to Dallas. So Dallas is in the top 10 worst in the nation for ozone pollution, according to the American Lung Association's 2025 State of the Air report. They came up with that by looking at the number of ozone days. You can see that if you go to the weather app, it will say if it's an ozone watch day, or if you check Air Now or look at the HAQ app, as we will talk about later. And then another thing that they looked at was particle pollution. So with short-term spikes, it was not as bad, but with the year-round average in particle pollution, the DFW area ranked 30th worst in the nation for exposure. And then also there was a Texas Department of State and Health Services report in 2025 that showed that 4 metropolitan areas, DFW being one of them, did not meet federal standards for ozone pollution. And of all of the ED visits and hospitalizations for asthma in the state, 59% of those were in those 4 metropolitan areas. This is a different study that looks at pediatric asthma in Dallas. And that one, you can see that the darkest red, looking at the picture on the left, the darkest red areas are the areas with the highest asthma rates in children. And those are in some of the most disadvantaged areas in Dallas. But then if you look at the picture on the right, which is the heat map, they don't 100%, but you can see that they kind of correspond to the more orange and darker orange areas.
Sorry, I'm having trouble muting and unmuting myself without getting away from the slides. So, you know, this is all challenging information to be discussing, and it begs the question, is there anything we can do about this? And so this is a neat study in the last year looking at the use of air purifier on blood pressure. And so, you know, reducing the pollution that folks are exposed to with particulate matter, the PM 2.5 from highway pollution, actually improves hypertension control. So this was a pragmatic randomized crossover trial where they had 2 groups, one side that was exposed to HEPA filters. And so they had the HEPA filter running, clearing and cleaning the air out in their living spaces. And then the other group had shams. And so the blood pressure was checked at baseline. And then after a month, they had a month washout, and then the group switched over. So the people that had the clean air were now exposed to just the general air coming in through the highway or the sort of arterial where they lived. And the other group was then switched over and got the cleaner air. And so if you were someone who started out with hypertension with a blood pressure greater than 120 millimeters of mercury by systolic, you actually did better with the cleaner air, and the blood pressure was reduced by 3 millimeters of mercury. And that's just, again, 1 month of having cleaner air and proving the point that, the pollution, the air we breathe, has a direct connection to our blood pressure and our health. And it's a reminder that, just so these guys that were hypertensive reduced their blood pressure by 3. So every 2 millimeter increase in blood pressure translates to a 7% increased risk of death from ischemic heart disease and a 10% increased risk of death from stroke. And so these, decreasing your blood pressure by 3 millimeters of mercury is a real important impact for these folks. And as Sheila was just mentioning, when we think of both health inequity and childhood asthma, this is a study from JAMA recently looking at Curtis Bay, Maryland, which collects all of the coal from West Virginia and the mines in Western Pennsylvania, and they are all transported by train to this coal storage terminal where it's handled and moved around. And it begs the question of if the air we breathe is affecting our health, which we just saw, and is your zip code a modifiable risk factor? And so this team, looking at the impacts of structural racism, had money to move people from where they lived to areas that were not as close to this industrial area, and had cleaner air. And so it was 123 children with asthma. And the end result is when they move them further away from this polluted air, their mean exacerbation rates of asthma went from 1 to like half per person year. And the number of symptom days was cut down from 5 to 3. And so these are big changes. These are people that already had existing asthma, and all of a sudden the asthma is better controlled just by living in an area that doesn't have as polluted air. And so this was a study in the same neighborhood where they basically proved that what these folks were being exposed to, and it should come as no surprise, it's this huge, hundreds of thousands of tons of coal that's being transported through their neighborhood. And it's being handled. It's all this black dust is being spread through the air, and it's affecting the places that they play and live and work in. And so just in 2 different sites, they looked at the black particles that were settling on the playgrounds and sites where people live. And it turns out that it is coal dust that they were exposed to. And so this is all to say that, there is a fossil fuel pollution problem. And so PSR National just sponsored this fueling sickness report looking at the hidden health costs of fossil fuel pollution. And it is, we've been talking all along about how all these things are linked. And the more fossil fuel that we consume, the more pollution, exhaust, and heat and carbon dioxide is released. It's all dangerous byproducts. And so the real prevention from an Earth standpoint is leaving those fossil fuels, that coal, that gas, that oil in the ground. And so renewable energy sources, solar, wind, minimizing your energy consumption meet the dual goals of improving personal and planetary health. And so we'll transition here into asking the question, how, with all this knowledge, how can we use this to protect our patients? And so what we can do is we can educate our patients, and that's both the HAQ app, the Heat and Air Quality app, and also the Infographic, the Air Pollution in Your Heart infographic. And so I think it's important that we start these conversations in the clinic. I know we're all always short on time in clinic, and it can be hard to broach these subjects with patients, but we hope through the remainder of this talk we can show you methods of how these two tools can help prevent and mitigate some of the worst ravages of climate change. Another thing we can mention is it turns out you can bill for this. I learned this as we were preparing for this talk together. There are these CPT codes, 99401 and 99404, that you can use. And in addition, there's ICD codes for air pollution and environmental pollution that you can potentially use. I'm certainly not advocating to bill for these sorts of things, but this is a way of, in a sense, justifying it as a real thing. And so both Dr. Modi and my goals are to give patients the tools to protect themselves and to be knowledgeable about the risks that they're more and more exposed to in the environment. And so I had the privilege of working with the American College of Cardiology Board of Governors in creating this infographic on air pollution and your heart. And it goes through a lot of what we just talked about, how air pollution increases your risk of all sorts of adverse events from a cardiovascular and general medicine perspective. It goes through what air pollution is and then what you can do, for example, checking outdoor air quality levels, limiting your exposure on higher risk days. I have plenty of patients that, when it's wildfire season, we talk about how they should be limiting their outdoor running and keeping an eye on what the air quality is outside. And also for severe smoke events, having a plan, trying to avoid your exposure to smoke, for example, open fires, engine exhaust, tobacco smoke, and paying attention to indoor air quality, and of course, limiting your energy use to help lower pollution, because this is really the only way of getting ourselves out of this trouble. And so the infographic makes the direct connection between air pollution and cardiovascular disease. And it both serves as an education to clinicians and patients, and it importantly starts the conversation that's so critical. And so thank you to everyone who was involved. It was a big group effort, including the American College of Cardiology infographic team, and also patient feedback. I will say I was very impressed working with this group, that they enlisted patients and also providers about what they thought of it and what we could do better. And so for those that are interested, on the CardioSmart American College of Cardiology website, in alphabetical order, so air pollution sits right up at the top, you can find and download this. In Portland, Maine, where I practice, or actually in Scarborough, Maine, just a little bit south, we put these all up around in our clinic in each of the exam rooms. Patients frequently are looking at it while they're being roomed, and it provides an easy foil to point to and start the conversation. And so this is a QR code, which you'll see again later on in the talk for those interested in downloading this infographic. And so we internally, and with the help of our fellows, wanted to know what patients know about this and how the infographic exposure, and I'll use the word exposure to describe, in this case, a good exposure, which is seeing this infographic, or we think it is at least, how that changes their thoughts and opinions. And so two of our fellows, Dr. O'Brien and Khalil, along with a amazing nurse, and that should just be RN, apologies, Darcy Chandler, and have enlisted the support of our patient service representatives and our medical assistants in filling out, at this point, 55 total surveys. And so this is what it looks like. They fill out the survey, they're exposed to the infographic, they read through it, and then they fill it out again. And it's been a QI project that we've been running for the past few months in the Fellows Clinic. And so some things, when we look at this data, some things are encouraging, some things less so. It turns out some people are worried that air quality will hurt their heart. Interestingly, few of them after they see the infographic. I'm not sure I understand that completely, but that is what the data is telling us. And also, potentially discouragingly, this isn't necessarily something that the majority of people are interested in talking about with their care team. And so more people are interested in talking about it after seeing the infographic, but the preponderance of patients in clinic are actually not interested in discussing this. Although sometimes these things change. I always find around, in the summertime when we're being exposed to the terrible wildfire smoke, literally everyone is talking about this, and that's all our clinic visits entail. So perhaps there's some seasonality to these responses, But it does, I trust what the patients are saying. It isn't something that they're looking forward to talking to all the time. Interestingly, in terms of our patients checking the air quality index, after they see this infographic and learn about the links of air pollution and cardiovascular disease, there's almost a quadrupling of people that are interested or that are, looking to check their air quality index locally. And this speaks to Dr. Modi's HAQ app as well. And so, the no's went from 34 down to 12 after seeing the infographic. And so, likewise, do patients change what they do when air quality is bad? And the majority of folks before seeing the infographic didn't, but then after the infographic, they are looking to change their behaviors and activities when the air quality is poor outside. And then, do they think they can protect themselves from and protect their heart from dirty air? A majority of people actually start out thinking yes, they can, and more people do after seeing the infographic. And the last two questions that we asked, one, do you have a plan to protect yourself? And yes, more people do, or an increasing number of people do after seeing the infographic, and fewer people do not have a plan after seeing the infographic. And then, do you think there are things they can do to help improve air quality? And this is a very interesting nihilistic response that, being exposed to the infographic doesn't seem to change their minds of folks in terms of what they can do to help improve. But importantly, the majority of people do think that they can help improve air quality index both locally and worldwide. And so the preliminary lessons from this infographic effort of looking at how patients are responding to it. While the majority of patients may not want to discuss air quality in clinic, the infographic does in fact change behavior. For example, increased air quality monitoring, having a plan, and changing what they do when the air quality is poor.
So what we have built to sort of meet this need is the HAQ app. And here is a QR code, and I would encourage you to download it and check it out while we talk about it. But we designed this app for patients, families, but then also for care teams to provide both real-time heat and air quality data that people can use. We have it at a neighborhood scale, which is more local than what you can always get on the weather app. And that's important because, as we know, that different neighborhoods can have dramatically different exposures as far as heat and air pollution. We try to make it user-friendly using plain language. It's written about the 5th grade level, has information and education, also resources, which is one of the things that I am most proud of on the app, and we'll talk about that a little bit more. But it is a platform that can hopefully be continuing to grow and adapt to local needs. Next slide. So if you look on the app and you click on the HAQ widget, what comes up is this first picture in the middle of the screen. And it tells you neighborhood level. My neighborhood is Entry West. So that was the air temperature at the time that I was putting this together. And then another thing I like is that we included the wet bulb temperature. And for anyone who's not familiar with the wet bulb temperature, all that means is how much you are able to cool by evaporative cooling, which is sweating, right? So it sort of measures how effective sweating will be to cool your body. And they measure this by literally putting a wet washcloth on a thermometer bulb and seeing how much the temperature drops. But also now it's just calculated using humidity and a few other things. And then it also has air quality and tells you what is the major pollutant in the air at the time. And then there's also an air quality widget. So the data from this comes from Air Now, but then there's a air quality. You can click on it and it takes you to the Air Now site, which is the picture you see on the right. And it will give you even more information about the air quality. Next slide. We also have an education section on the app. We have, it's called Did You Know? And this section has educational videos in plain language. We hope to build this education section out more in the near future, and we're going to have text with educational content on various topics, specifically geared towards groups like outdoor workers or people with heart failure on diuretics, things like that. And then we have a resources page. And this is, I think, one of the best parts about the app because, as I mentioned earlier, a lot of our patients may be affected by the lack of resources. Like they're not able to turn on their air conditioning in the heat, but they don't know what the resources are. And so on this app, it has a really like you can search in a search bar for resources, or it has a drop down and you can look. So on the picture on the left-hand side, there's local heat and utility resources. And then if you click on that plus sign, it takes you to the screen on the right side of the screen. And it just lists out all the different local resources and has links. So you can literally just click on it and it takes you to that site. And so they can, go to Reliant.com's financial help page and just do it right there. And so it makes resources more accessible. And as we keep getting partners, we keep adding to the resources. Okay, you can go to the next slide. And then we also have developed tip sheets. And these are designed to be used for maybe social workers or community workers that are trying to educate people on how to use this app. And so these tip sheets, again, are developed in plain language, 5th grade reading level. So they've got some basic information on, things you might need to know, and then what to do and how to use the HAQ app. And we have different tip sheets for different populations. So we have like older adults, pregnant people, people with asthma or COPD. So we have different groups and more specific information tailored to each of these groups. Next. Here is the team that developed this app. We have 2 anthropologists, 2 physicians, and 1 tech developer. Next slide. And then just some things that are coming up for what we are doing. We have an upcoming pilot study and environmental justice tour partnering with Texas PSR. So we are working with a local community organization, Downwinders at Risk, to pilot the HAQ app in 3 North Texas communities that have really high pollution burden. Those neighborhoods are Joppa or Joppy, which is a historically Black freedmen's town with lots of industry around and really poor air quality. Also West Dallas, which if any local people have heard about Shingle Mountain, like that's where that was. So again, lots of air pollution. And then Echo Heights in Fort Worth, another community with a lot of air pollution. And then we're currently applying for an AMA microgrant, which will hopefully fund an environmental justice immersion learning experience for students to focus on these 3 communities. They'll get an environmental justice toolkit and they'll have a tour and get to interact with residents in these communities. And we're hoping that that will be beneficial for everyone, both the students and getting experience, but then also beneficial for the communities who will get education. So hopefully that will happen. So these are some of the stuff we are working on next. So in conclusion, hopefully you all have understood that air pollution and heat are increasing risk for mortality, and that there is an inequity in the burden of air pollution and heat in different populations, and that we do have some tools to educate people. We have the ACC Infographic and the HAQ app, and there's QR codes to download both of them. And I think at this point, we can open it up for questions.
Amazing. That was such an amazing presentation. I feel like I learned so much about pollution, heat. We will open it up for questions, so feel free to put any questions in the chat. But while y'all are thinking of any, I can go ahead and start with a question that I had. And it kind of is about policy and what policies would, in an ideal world, what would be like the next most important policy kind of surrounding like heat, air pollution, that y'all would like to see either on like a federal or a state level to help patients?
Colin, I'm going to let you answer that because you were recently involved in this.
I mean, I think a lot of it is really easy. Like just undo the undoing of the endangerments clause. Like it is now turning out that from a policy standpoint, polluters are no longer being held accountable. I was just hearing that there's legislation coming out of, I want to say it's a senator from North Dakota, maybe I could be wrong about that, where just like the gun industry sort of has immunity from deaths, there's legislation looking to have blanket immunity for climate deaths because more and more states are asking for, compensation from, in Maine, we have rising sea levels and there are houses that are being washed away and sort of these disasters in our downtown area on the king tides when the moon is full and it's a high tide. And so I think from a legislation like the it is a very ripe area because there's so much that's going in the wrong direction. You just have to undo those things. And I do think that ultimately, it is laws. I mean, I think it's important that we talk about this in clinic, but it is really laws and the decisions that are made at a macro level that have gotten us here in the first place, but also it's going to hold the keys to getting us out of this problem.
Yeah. And I mean, I think that there are so many different areas in which legislation would be super helpful. It's hard to pick one priority, but definitely another thing that would be very high on the list is having a national OSHA heat standard, which there was a big effort to do that, but now is questionable. But that would be something that would be very helpful and would protect a lot of people.
Yeah, thank you. Very helpful, and I completely agree. Any questions from the audience? And feel free to unmute yourself as well.
It looks like there was at least one in the chat from Bill. What about the availability of drinking water, especially for the homeless?
I mean, yes, that obviously is something that is very important. Um, Drinking water is one of the very important ways to protect yourself from heat and heat exposure. So having more public water available would be very helpful. I know that in cities like Dallas, that is really not been a priority. And so we just really don't have much of that. We have libraries and cooling centers, but they're pretty spaced out and there's not a lot of options beyond that.
And the other thing, Sheila, that you mentioned when we were talking, just along those sides of, sort of people that are vulnerable to these things, that bulb temperature, I keep playing it over in my head what that means and how if the bulb temperature, I think you said if it's above 95 degrees Fahrenheit, you basically can't cool yourself down and you again all these things I think about like the heart failure spiral where you're just you're quote unquote off the Starling curve. It's just there are these tipping points where things get out of control, and so that 95 bulb temperature ends up being just a fatal death knell, which was very interesting. I don't know if interesting is the right word, but it was a sobering realization to learn that. So. And I see Bill Barker also commented that in California, state law prohibits schools being built near busy roadways, and I think that's important. And it's throughout the lifespan that these exposures happen, and so I think for children to be learning again, it's the asthma, but also it's priming for future hypertension, and it's all inflammation, it's all trouble, and limiting that exposure is critical. So I'm happy to see that there's a law doing that. Again, laws are unfortunately, answered. They need to be thoughtful, but sort of left unchecked, oftentimes without proper regulation, the sort of the spinning out is it's going towards more pollution.
Another quick question I had was, how do y'all approach the conversation about heat waves with patients in clinic with the limited time that you have? Like, do y'all have like a go-to like spiel that you give, or um, I'm sure it's different based on different kinds of patients, but I was wondering if y'all have any advice on that.
I don't have a go-to. I tend to try to target it towards who I'm seeing. Definitely, I bring it up if my patient is an outdoor worker,
Mhm.
or if they, work at Amazon or something like that in some kind of warehouse or air conditioned space. I definitely will bring it up with them. I'll also bring it up sometimes for people who are unhoused, or if they um, say that they have trouble storing their medications. Like there's a lot of different ways you can go about talking about it. So one of the ways I brought it up with another patient was someone who has diabetes and was on insulin, and we talked about um, how to store her insulin when she was unhoused. And so sometimes you can find something that's going on with that patient that can kind of lead you to the discussion.
Yeah, and oftentimes when I'm looking through the social, when I'm talking with a patient about social history, what do they do for work? Where do they live? Oftentimes that prompts the exposure questions. If I'm asking about air quality, you know, it's like, oh, so you're working in the mill. What are they burning in the mill? Do they have proper protection? Do you have access to protection? Do you ever have, I have patients occasionally that have pain, chest pain that's worse when they're in certain areas when the air quality is worse. And so a lot of times these things happen organically. But again, the purpose of the infographic is to have just something, if I'm struggling, I just point to it and say, did you know these two things are related? And are you interested in learning more?
Very helpful. Thank you so much. I think we're about out of time. So thank y'all so much for joining. Thank you, Dr. Modi and Dr. Phillips, for the educational presentation. And I think we will call that a night. Good night, everyone.
Thank you.
Thank you guys very
Thank
much.
you.